Welcome to Friday Conversation, presented by Friday Culture. Today, we are glad to have Dr. Dennis Lam, a renowned eye medical expert and also a legislative counselor. Welcome, Dennis.
Hello. Yeah.
Let's talk about the COVID first. Now that COVID cases are largely under control with about several hundred for more than 2 weeks. So I know you're a supporter of compulsory universal testing, but many people in Hong Kong, in particular the expatriates, are worried about the lockdown. So can we achieve a universal testing without a lockdown?
I think basically we have two paths. There are people who are suggesting using the rapid antigen testing, the RAT, to do this universal testing. RAT is good in the sense that it can catch those COVID positive cases when their virus load is high, but we will be missing out those who are not having high virus load.
Right.
So that means you do not achieve what you want. When we want to have universal testing, we want to catch all the cases, no matter your virus level is high or low. So that means we must use PCR. So when use PCR, then we have to make sure that the risk of cross-infections when we take the samples is low. The risk is not really that high. And number two is that during that period, if we have no lockdown, there are still positive cases running around in the community, so we can be sort of make the risk low. So actually, we can do the university PCR testings without a lockdown. By what? By number one, using RAT to screen out those cases with high virus level, and they will stay at home and go along with the ordinary system to have the isolation. And then for those who come out, we have to wear the high efficiency mask because the ordinary surgical mask, there will be leakage. The fitting is not really too good. So everybody is wearing a surgical mask and before they go to the testing station. And in the testing stations at this moment, because the number of cases are not that many, so that means if we have good ventilations and also we put up a strong fan so that when we take off the mask and have the sample done, the fan will be able to make the virus really diluted to make it much less infectious. So if we take all this measure together and no die-in during that 2 weeks period, then we can actually make the risk of cross-infections very low. And if we can go along with what I've just proposed, we can actually do a good we can do a good universal testing without lockdown. And only when we can do that, the society will feel safer. And also, this is a prerequisite for opening of the border.
Dennis, you are a renowned eye medical expert, but many people get to know you as the chairman of a listed company, Sima Eye Care, which operates clinics and hospitals in Hong Kong and the Greater Bay Area. Can you share with us why and how you started your business in GBA, and how do you overcome institutional barriers, as we know the mainland is adopting a very different medical system?
I think number one is Hong Kong has something to share. Because we have a very high medical standard. Our two medical schools, Hong Kong U and Chinese U, they belong to the top 100 medical schools in the world. And number two, medicine is universal. So if we can serve our people in Hong Kong nicely, we can also do the same in China. And actually, we have even more because the two systems are quite different. So our professionalism, our spirit, our management, this is something that the Greater Bay Area is not adequate. So we have something to share. Then how can we cross the barrier? So I think from two perspectives, one is from individual doctors, and then the other is from the medical institutions, the corporates. So basically for doctors, we have to have attractive package. I think patients are taught a lot, patients out there in China, it's not the issue. So we have to have these practice without examination. So we can register without a examination to support the doctors to go there and then test benefit, and also language is another barrier. And when we have to cross the border, the time spent in travel, so on and so forth. So I think a lot of policy can be put together to support there. On the other hand, is the institutions. So the registration process is quite tedious and complicated in China. So we can certainly have improvement over those areas.
You managed to overcome that, yeah.
Yeah, and I think the other very important thing is that very recently we have something called Drug Connect. So basically, for drugs that we use in Hong Kong, great majority of them are also being used in the US. But in China, people have to wait for 5 to 10 years before those drugs are registered in China. So with this new policy, the Drug Connect, so in designated hospitals who are organized by Hong Kong people can be given this privilege to use drugs that are being used in Hong Kong.
Okay.
When they are still not yet registered in China. So this is very important. Why? Because all of a sudden you have a certain disease. So the treatment that you are receiving in Hong Kong, now you can do the same in Greater Bay Area. So the standard suddenly raised a lot. So I think overall speaking, Hong Kong has a role to play. We can, provide the service. We can lead the reform directions. We can help elevate the standard, and finally, we hope that the whole Greater Bay Area eventually become more or less the same standard, and then we will become sort of closely connected to the international medical community. So I think Hong Kong has a special role to play.
Right. We know that many Hong Kong people are moving to the Greater Bay Area for studying, working, and even retirement. But Hong Kong's public health care resources are in short supply. But if Hong Kong people choose to visit hospitals in Guangdong, they could not enjoy subsidized services. So do you think the Hong Kong government should subsidize cross-border medical and even retirement services?
I'm in 100% support of this thinking because Hong Kong has only 7.4 million populations. And then in terms of the serving population, is much less when compared to the scenario that we are able to cross the border.
Right.
So we are talking about hundreds of millions of patients. So this is most advantageous to the medical community in Hong Kong. And in terms of patients, because of the closer and closer tie, there will be people from Hong Kong going to the Greater Bay Area that require the medical service. So if we can, the Drug Connect is one I just mentioned. And then if we have this patient data connect, that means your personal history of illness, the drugs that you are using, if it could be cross the border, then we'll be in the best benefit of the patients. And you mentioned about these medical benefit. Again, if this can be sort of connected to the Greater Bay Area, then they can use the service over there. And many of these services, they are organized by the Hong Kong people. They are of good standard, but because of the overhead is less, then it could be even less expensive than that of Hong Kong. So I think with the view that, the two places are really integrated more and more, and then the need will be more and more. So I'm in full support of the policy that some of the medical benefits that Hong Kong people are enjoying, they could be open so that when you are in Greater Bay Area, you can also use those benefits.
Finally, as an NPC deputy, what would you do to promote Hong Kong as a medical hub for China and also promote mutual recognition and cooperation for medical services between Hong Kong and the mainland?
I think NPC is at a high policy level. So for some of the problems that I mentioned, I think for one way or the other, for example, I have been writing these proposals throughout the past years to talk about how can we encourage more Hong Kong doctors to go to the Greater Bay Area and also the medical institutions. So I think the policy sort of reform is something on table. And number two, I also mentioned that Hong Kong has a special role to lead the development and the elevation of standard of the medical services in the whole Greater Bay Area. So if we are able to do that, then it's quite natural there will be mutual recognition. At the moment, because of the disparity, I think it's difficult for the Hong Kong professional to accept this mutual recognition. But I think we are moving a direction of convergence. So eventually, mutual recognition is possible.
Thank you very much, Dennis. That's the end of today's Friday Conversation. If you like our program, please like, share, and subscribe to our Friday Everyday channel. I'm Henry Ho. See you next time.